Well, new data just released by the CDC shows the disproportionate impacts of the flu on Black and brown communities.
CBS 2's Jessi Mitchell explains why the reasons may be more social than scientific.
The Centers for Disease Control and Prevention aim to raise awareness about immunization as flu cases in the U.S. have already started to climb.
The main message is not to be complacent. I mean, we've had 2 mild flu seasons, which actually means that we might be ripe for a severe flu season.
The virus tends to have a greater impact on certain minority populations. Researchers reveal that from 2010 to 2020, 80% more Black people went to the hospital with flu complications than white people. Native Americans and Hispanics also had higher hospitalization rates than whites. The disparity translates to vaccination rates, which experts can tie to the generational effects of experimentation on the population.
Due to historic events and systemic racism, I think, mistrust and misperception of the vaccine is higher.
Have you found that the pandemic has changed some of these historic cultural biases against vaccines?
During the first pandemic year, we actually saw an increase in influenza vaccination, perhaps coinciding with people getting COVID vaccines.
CDC partnerships have capitalized on the connection, supporting awareness campaigns and vaccination drives in mobile clinics, churches, workplaces, and other community groups across the country. But they acknowledge the issue goes even deeper.
What we also saw in the study is that access to care factors, such as having health insurance, having a doctor visit in the past year, having a primary care physician, those things were all associated with higher vaccination coverage.
Besides the boost of immunity, as we get back to gathering, remember the basics.
I know people are not wearing masks and social distancing as much anymore, but obviously other common hygiene measures: wash your hands, stay home when you're sick.
Diligence makes a difference. Jessi Mitchell, CBS 2 News.